السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا لمراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 5 in Leadership and number 35 in Ghaith Review. Today we are going to discuss 5 questions from question number 192 up to question number 196. معكم محمد اسماعيل يحيى. نبدأ مباشرة. Question number 192. The head nurse meets with the staff nurse to discuss ways to improve communication among shifts. Which of the following statement best exemplifies the final stage of conflict management? The options are: number A, we need to clearly define the nature of the conflict. Number B, I will evaluate the outcomes of the strategies used monthly. Number B, let us create a timeline for the implementation of our strategies. Number D, I have to force you to follow the rules to resolve the issue. وقف الفيديو هنا واختار الخيار اللي تشوفه سهل. The correct option is option number B. I will evaluate the outcomes of the strategies used monthly. ليه اخترنا الخيار رقم B؟ نشوف rational. Use the steps of nursing process and remember that the nursing process has 5 consecutive steps: assessment, diagnosis, planning, implementation, and evaluation. And remember that evaluation is the final steps and it is an assessment process to ensure the desired outcome has been met or not. So the correct option is option number B. I will evaluate. This is the final stage of conflict management. I will evaluate the outcomes of the strategies used monthly to make sure that the conflict has been resolved. Question number 193. A head nurse of coronary care unit delegated staff scheduling to senior nurse. فوضت جدولة العمل بتاعت التمريض ل senior nurse in that unit. Which of the following steps must the head nurse implement before delegating tasks? The options are: number A, check the hospital policies for delegating tasks. Number B, explain the task to the senior nurse. Number C, negotiate with the senior nurse. Number D, take the signature of the senior nurse. وقف الفيديو هنا واختار الخيار اللي بتشوفه سهل. The correct option is option number A. Check the hospital policies for delegating tasks. ليه اخترنا الخيار رقم A؟ نشوف rational. Delegation is the act of transferring responsibilities for the performance of an activity or task while retaining accountability for the outcome. From the principle for delegation, the register nurse should consider facility or agency policies and procedures and the knowledge and skills, training, diversity awareness and experience of any individual to whom the register nurse may delegate elements of care. So the correct option is option number A. First, the head nurse should check the hospital policies for delegation or for delegating tasks and then explain the task and negotiate with the senior nurse and take signature from it. Responsibility can be delegated. المهام ممكن نفوض, but accountability cannot be delegated. Question number 194. What must be known on legal point ما هي النقاط القانونية التي يجب معرفتها في عملية delegation اللي هو التفويض when processed to a new nurse إذا عايز تعمل عملية تفويض لممرض جديد. The options are number A evaluation of performance of delegate by client. Number B actual time it takes to complete the task by delegate. Number C institution definitions of the job description. Number D number of times that the delegate has previously taken. وقف الفيديو هنا واختار الخيار اللي تشوفه الصحيح. The correct option is option number C institution definition of the job description. اللي يختار الخيار رقم C نشوف rational. The ability of a staff member to perform a specific task is not only based on their competence, but it is also based on their legal scope of practice or job description and healthcare facility policies and procedures. So, the most important legal point to be checked when delegating are scope of practice أو ما يسمى ب job description and in addition to healthcare facilities policies and procedures. So the correct option is option number C institution definition of the job description. Question number 195. The nursing director wants to evaluate the quality of nursing care at the inpatient area. The management team will evaluate on quarterly basis the documentation and the relationship between the patient length of the stay and the quality of care. Which of the following is the most important data source to identify the quality of care? The options are number A patients complaints and time taken to resolve them. Number B patient satisfaction level at the time of discharge. Number C details of nursing notes for patient progress. Number D actual time it takes to complete the task by delegate. وقف الفيديو هنا واختار الخيار اللي تشوف صحيح. The correct option is option number B patient satisfaction level at the time of discharge. اللي يختار الخيار رقم B نشوف rational. Patient satisfaction is the most important indicator of quality of care and it considers an outcome of healthcare services. So the correct option is option number B patient satisfaction level at the time of discharge. Question number 196. The nurse manager received complaints from some nursing to improper work distribution and discrimination. How should the nurse manager handle the situation? The options are number A investigate the complaint. Number B individual counseling. Number C identify list of problem. Number D continue to observe. وقف الفيديو هنا واختار الخيار اللي تشوفه صحيح. The correct option is option number A investigate the complaints. ليه اخترنا الخيار رقم A نشوف rational. The director of nursing must examine the complaint and initiate an investigation to find out the truth first and then to determine the causes of the complaint and any contributing factors and opportunities to prevent its recurrence. So the correct option is option number A شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.